So when do you get concerned about a blood sugar level?
Well, I mean, I would say that if someone is testing their fasting blood sugar and it's chronically above 100, not just in the morning. Now, the morning is important because the morning is when when your cortisol goes the highest, right? Your cortisol rhythm is like this. It starts here at waking, it pops up within the first 30 minutes and then goes down during the day. So some people may have higher blood sugar in the morning because of that cortisol spike. And that's okay. That's normal. The question is, how does it look during the day as that cortisol drops? So those are the big questions that I always have. So all patients do a functional glucose tolerance where they test their fasting, 1, 2, and 3 hour blood sugar, at different intervals during the day so we can get a window of how that blood sugar fluctuates. So inflammation is going to have a major effect on your blood sugar. Emotional stress will have a major effect on your blood sugar. And a big vector for inflammation is going to be gut issues. Issues.
And I forgot to mention too, you're right. Her calprotectin, her intestinal inflammation marker, it was pretty darn high. It was at, I believe it was at 96, and anything above 50 is flagged high on the test that you and I used.
That's big. Yeah. That's big.
She was pretty inflamed, and the emotional stress piece was a factor too. She had just recently gone through a divorce. She's got 3 kids that she's trying to keep up with. So that's a big deal. And I think the case studies like this are important to share because the data can only take you so far. But when you hear a story like that, it's like, oh my God, this makes sense. And this lady, she's been burning the candle at both ends, going through a divorce for however many years. It's been a year in the making with 3 kids in the middle of it. That's stress.
Totally. So the other big thing is if the gut's chronically inflamed, that's creating stress. But if the gut's also inflamed, there may be a bottleneck in how this patient's able to digest and get these nutrients into her bloodstream and have a stabilizing effect.
Is there anything else we should say about blood sugar? The gut influences blood sugar too. We do find with a lot of people with gut infections, which is something we test everyone for, with parasites, bacterial overgrowth, et cetera. Kind of like this fasting thing you've mentioned. Some of these gut bugs are stealing your amino acids. Lyme and some of the co-infections with that can take amino acids too. So if you do have gut bugs, that may be part of the reason why your blood sugar is crap. So if you're trying to do adrenal stuff, you're trying to do fasting work and you can't adjust, you've got to get the gut looked at too.
100%, right? So a lot of these, let's just say microbes or infections, they like processed sugar. Processed sugar is really easy for our body to process, right? It's really easy to take in and to utilize it for energy. And it's kind of has this addicting like effect. It can boost up dopamine. So these critters get that and they produce chemicals inside your body that causes you to crave it. So that's why I see a lot of people like, oh, well, just eat what you like and do this and listen to your body. Well, how do you do that? How do you do that if you have infections or yeast overgrowth or bacterial overgrowth, and these critters are causing you to crave certain things that may not be right for you, but may be right for them? That's where knowledge needs to come in so you understand why your body's doing what it's doing.